Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about EMG and its concept. So EMG, also known as electromyography, is an experimental technique concerned with the development, recording, and analysis of myoelectric signals, which are formed by the physiological variations in the state of muscle fiber membrane. And classical neurological EMG, where an artificial muscle response due to external electrical stimulation is analyzed in static condition. So the focus of kinesiological EMG can be described as the study of voluntary neuromuscular activation of muscle within the postural task, functional movement, work conditions, and treatment training regimes. So what are the uses and benefits of EMG? So it allows to directly look into the muscle, measurement of muscle performance in decision making both before and after surgery, document treatment and training regimes, help patient to find and train their muscles, allow analysis to improve sports activities, detect muscle response in ergonomic studies. The concept of EMG, the smallest functional unit to describe the neural control of muscle contraction process, is called motor unit, which are composed of anterior horn cell, one axon, its neuromuscular junction, all the muscle fiber innervated by that axon. Next, we are having the motor unit action potential. It is the summation of electrical potential from all the fibers of that unit close enough to electrodes to be recorded. Depolarization produces electrical activity called motor unit action potential, which is recorded by EMG, and each muscle fiber makes a contribution to motor unit action potential. So in this we can see the motor unit action potential in this figure. Instrumentation. Input phase include the electrode to pick up the electric potential from contracting muscle. In the processor phase, electrical signals are amplified and filtered. Output phase, electrical signal is converted to visual or audible signal so that data can be displayed or analyzed. So in this figure, we can see the anatomical landmarks on human body in the dorsal and the frontal view. Normal EMG at rest, there is no spontaneous activity in the skeletal muscle of normal individual. In case of minimal voluntary activity, few motor unit discharge, few action potential are recorded. In increasing the voluntary effort, more motor unit discharge means there is recruitment of more motor unit. So high is the action potential and potential can be recorded as shown in this figure also. Now these are the application areas of kinesiological EMG. Application areas like ergonomics, which for analysis of demand, risk prevention, ergonomic design, product certification, post-surgery, neurological rehabilitation, active training, and in medical research for surgery, orthopedic, functional neurology, gait posture analysis, and in sports sciences for biomechanical analysis, movement analysis, athlete strength training, and sports rehabilitation. So what are the most important sources of noise? Tissue characteristics, skin impedance, superficial fat, physiological crosstalk from neighboring muscles, from ECG, breathing, from cable movement, ambient noise, most common sources of electrical current, quality of electrode and amplifier. Most of these can be minimized with optimal preparation. Thank you.